Hello and welcome to another edition of Currently in Quincy. I'm Joe Catalano, and today on the show we will catch up with Rick Doan from Interfaith Social Services here in Quincy and talk about their virtual Stop the Stigma 5K that's coming up in April. First, though, we check the news for you. Quincy will be receiving just over $46 million from the $1.9 trillion American Rescue Plan that was approved by Congress to help the country recover from the pandemic. 8th District Congressman Stephen Lynch joined Mayor Thomas Koch and House Speaker Rahm Mariano of Quincy at City Hall back on Monday to unveil that new spending package.
Of course, we're very, very focused on Quincy, and I'm sure that the mayor will find good use for the $46 million that we're able to get to the mayor. Council President Liang says she's already got the money spent, so we're happy about that. I'm kidding, of course, but there's such need here. Remember, when you look at the previous numbers we had in terms of tax revenue, this is just a fraction. This, as big as this bill is, this is just a fraction of what was lost during the last year during this pandemic, because restaurants have been shut down. We did look closely. We looked closely at the impact on small businesses. So we've greatly expanded the PPP, that payroll protection plan. We've also created a special fund directly for the revitalization of restaurants, especially small restaurants. So there's, I think it's $26.8 billion for restaurant support. We have looked very, very closely at transportation needs. So there was $8 billion for airports, rail transit systems. There's $8 billion overall for the state.
Mayor Koch said that he would use the money over the next 3 years to boost up revenue that was lost due to the pandemic, including lower hotel and motel taxes, meals taxes, and even delayed property taxes. The mayor estimated the pandemic has already cost Quincy $20 million. All of the estimated 3,000 residents living in Quincy senior citizen housing will have the option of getting a COVID-19 vaccine if they so choose. During this week's City Council meeting, mayoral spokesman Chris Walker said the city has been working to make sure that the vaccine is available to any eligible senior who wants one.
In some of those supply issues that, between the middle of February and the beginning of this month, that all of us are reading a little bit about and talking about in detail. Initial reach out had been made to the corporate folks at 1000 Southern Artery. There had been some progress. There was anticipation that a clinic would have been scheduled in the immediate term based upon those initial conversations. But unfortunately, the supply chain got in the way. It became a little bit frustrating to the folks in those buildings and their family members, because they were noticed that the vaccine was coming. So through a lot of hard work by the folks at Brewster, the PFFM, and their teams, they were able to resolve those supply issues. That issue has been rectified, and again, those buildings, there will be vaccination clinics this coming weekend. And we also believe that 91 Clay Street, Wollaston Manor, will also be part of this pilot program with the mobile clinic. Some of the other buildings in the city, as I mentioned, they went straight to the pharmacy operation that's being run in partnership with the federal government, and there has not been substantial city involvement, but these particular ones relative to the Brewster Ambulance and Firefighter program, the city was involved with. And as I noted, we think we pretty much have all of the senior facilities in the city covered at this point.
The Quincy Housing Authority recently partnered up with Stop and Shop pharmacies to provide the vaccine to all eligible tenants in public housing. And Manic Community Health Center is offering COVID-19 vaccines to Quincy public school teachers and staff members. A husband and wife from Quincy are charged with robbing two Asian pedestrians last month as they walked near the North Quincy T station on West Squantum Street. 34-year-old Brian Kenny and 38-year-old Angelina Kenny are charged with the attacks on a 69-year-old man and a 55-year-old woman on February 18th at different times of the day. Police say Brian Kenny assaulted the victims, leaving the man with a head injury. The woman was not hurt. There was concern that the attacks were hate crimes. Police say the suspects are substance abusers and that the robberies were crimes of opportunity. In the wake of the massage parlor murders in Atlanta this past week, Quincy Mayor Thomas Koch wants to assure Asian Americans living in Quincy that they are safe. In a video message posted last night, Koch said violence and discrimination against Asians living in the city will never be tolerated.
I understand that the recent events across the country have left many of you with a great level of fear and concern. I want you to know that I hear you, and this city is here for you. And we will not, and never have, tolerate any kind of discrimination, racism, or other hateful acts against members of our community. I'm extraordinarily proud of our Asian American community in the city, which today makes up almost a third of our entire population. I have seen firsthand as these immigrants, children of immigrants, and grandchildren of immigrants have grown and flourished over the years to become absolutely vital to the fabric of our community. Like so many from so many backgrounds going back hundreds of years, your families came to this country, most with very little, in a search for something at the very heart of the American experience, and that is a better life. You should feel safe in your home and your property, and be assured that Quincy is a safe city for you and your loved ones. We will, and always have, do everything in our power to ensure that you feel that way.
Census data shows there are about 30,000 residents of Asian descent living in Quincy, the highest per capita in the state. The Norfolk County DA's office will be hosting a virtual forum on anti-Asian racism next Tuesday evening at 7 p.m. Granite Telecommunications of Quincy has donated over $7.5 million to Boston Children's Hospital from their 8th annual Saving by Shaving fundraiser. Over 1,200 participants took part in the event, which was held virtually this year due to the pandemic, including Patriots coach Bill Belichick.
Get my hair cut for Saving by Shaving, and very proud to be a participant to support Boston Children's Hospital, and want to thank Granite for their leadership in promoting this and giving me the opportunity to participate. So, Brandon, cut away.
Other notable participants included former Patriot Rob Gronkowski, former Boston Bruins and Red Sox players, actor Mark Wahlberg, and Governor Baker. Granite Telecommunications donates $2,500 per participant, and then CEO Rob Hale's family matches that to increase the donation to $5,000 per participant. The event has raised more than $42 million for Children's Hospital since it was founded. Coming up, Rick Doan of Interfaith Social Services joins us next.
The COVID-19 vaccines can be our chance to get back to our plans, who we are, what we miss, to get back to each other, to life. But it's okay to have questions. Like, how were the vaccines tested? In rigorous clinical trials among adults of diverse backgrounds. Can the vaccines give you COVID-19? You cannot get COVID-19 from a vaccine. Why should I get vaccinated? Protecting yourself also helps protect the people around you. Find the latest information at getvaccineanswers.org.
hear someone go, "Didn't it come from you guys?"
Strangers cough at me.
Move away from me.
Someone spit towards my direction. All the stereotypes that we've worked so hard to break are just going to be reversed. And I won't let that happen.
We all have to play our part.
I donate my plasma.
I've been making masks.
We deserve respect as much as everybody else.
I'm a firefighter, not a virus.
I'm a mask maker, not a virus.
I'm a nurse.
I'm a delivery woman, chef, a neighbor,
Artist.
Bus driver.
I'm a doctor.
Fight the virus.
Fight the virus.
Welcoming to the program once again, Rick Doan, the Executive Director of Interfaith Social Services here in Quincy, for an update on how things are going at ISS, but also about their Stop the Stigma 5K. Hey, Rick, happy spring.
Happy St. Patrick's Day. Happy spring. Happy vaccine. Happy everything.
That's right. All those things, and hopefully more in the future. How's life treating you there at Interfaith these days?
You know, it's volunteers that keep us running. Volunteers, support from the community. So we're good because we have that support. You know, we see so many donations coming in from the community, in-kind donations, volunteers, new volunteers. But we're seeing a lot of people coming in. Our food pantry, you know, anybody who drives by our building will see the line at our food pantry, the line of cars. Line of people. As the weather gets better, we know more people will be walking to access services through our food pantry like they did in the past. But we're keeping up. You know, some of the things, diapers is something we give out to all the young children that are served through the food pantry. In addition, we distribute feminine hygiene products. That's something new this year that we said this is a staple. And also incontinence products. You know, these are basic supplies that people need that we're distributing now. We've partnered with the Quincy Public Library, and all of the children, when their families come to the food pantry, they get books as well. These are not to return. They're books to keep in their home. So we're getting donations from the library, from our donors, and all of the children we serve are getting them. And then this month, they're all getting bunny baskets as well. You know, bring a little bit of happiness.
That's great.
And so that's how things are going on the food pantry side.
Okay. What are your other services, of which there are many?
You know, our homelessness prevention program, we've had to double that budget. And so luckily we put out a fundraising appeal. The community rallied and we were able to raise $50,000 for that program to match a donor that was contributing $50,000. So they gave a challenge, so we were able to double the budget for that program to keep up with the demand. You know, we had spent our whole budget for that program halfway through this fiscal year. So trying to keep up with people who are in need, really being a bridge for federal assistance. You have people that might qualify for some of those federal dollars, but it's taking 3-4 months for that assistance to come through. So we're able to go in, negotiate with a landlord, keep them in that housing till that federal assistance comes through. And then our counseling center, really we're seeing record-setting levels of people coming in for a variety of reasons. You know, it's the pandemic. Our counselors have said it's an intensifier, that people that already might have been depressed or lonely or you know, feeling anxious, that the pandemic has just intensified all of that so much more. Also, you know, the rates of drug and alcohol abuse, you know, we're helping a lot of people, and we're glad we're at capacity. We're glad we're serving more people than ever because it means people are reaching out and we're able to help.
Yeah, I've heard it said that the next great pandemic is going to be depression and substance abuse, and it's probably true. We don't even know, I think, what the impact is going to be yet.
Yeah, I mean, and hopefully people will reach out. That's the key. The help is there for people, but it's overcoming the stigmas and the stereotypes that people have about mental illness that shouldn't be there. You know, there's nothing wrong with saying, I need help, and asking for that help.
Which makes the Stop the Stigma 5K road race all that much more important this year, right?
That's right, and that's why we call it that. You know, it's never been more of a time. It's wonderful to see more celebrities and people in the public eye talking about mental illness, talking about emotional, psychological, substance abuse. With these different things, it's great because it helps break that stigma down, but it needs to be at the person-to-person level, where, you know, people who have had these diagnoses or are struggling talk about it openly. It shouldn't be something that's kept behind closed doors. And so we are supporting our loved ones who have these diagnoses, those who struggle, and we're trying to fundraise to support our program that is providing that treatment.
Yeah, and of course, due to the pandemic, it has to be virtual again this year, but how does it work, Rick?
Okay, so normally when we've been doing the 5K for more than 40 years, and normally it would be that people would come in, you know, that day they could register and participate in the 5K. When the event, since this is our second year doing it virtually, people have to register ahead of time. They need to think ahead. So instead of it being on one day, it is instead of it being on one day, it is on a whole week. So April 26th through May 2nd. At any time during that week, people will participate in the 5K, but they need to register ahead of time. So they need to go into the website because we want everybody to feel that fun. So they register ahead of time. We're going to get them a t-shirt. We're going to get them a medal for participating. And then a week or so before that 5K week, they're going to come in and pick that up. So when people are out walking or running their 5K route, they might see others with that shirt on. You know, that idea of a community, it's that sense when you're out there with hundreds of people walking and running, it's that sense of that community spirit, and we hope that we can retain that. So we're asking people to register as soon as possible. And the beauty of it is, one of the days during that week is going to be nice. So it can't ever be rained out. It's never going to be too cold. It's never going to be too hot. You know, you register, you pick the route, and then you run it or walk it.
Is that how it worked last year?
Yeah, I live in Randolph, and my family, we mapped a 5K route around down North Main Street and around back to our house. And that's what we did. We did our 5K route as a family, and then we took a picture together and we uploaded it to the website. And everybody does that. They upload their time, how long it took them. And so we still have that sense of community in that sort of finish line, a virtual finish line.
Yeah, I would wonder too if you got maybe at least different participants than you might normally get, you know, if it were an in-person event.
Yeah, people in Hawaii participated last year. We had 5K participants. They won for the most beautiful, the most scenic view. But yeah, we had people all over the country that were walking and participating in this 5K last year. So it's one of those silver linings where we wish we could all be together, but isn't it wonderful that even though we can't, people can participate from far away?
Right. How much did you raise last year?
Last year we raised our record-setting $60,000, over $60,000.
Wow.
And we were blown away because, you know, there was so much uncertainty last year. And this year we're on track to do it again. We hope we can do it. We need everybody's help to do it. We're a little more than halfway there right now. So we need everybody's help to register, to fundraise, you know, to ask friends and family to sponsor them and to support them.
Yeah, and like you said, it can be a family affair. There's no ages, right?
No, definitely not. We got little kid t-shirts. And lots of times people will order the littlest, put them on their dog. If you want to do that, that's fine. Your furry friends are welcome to participate.
Yeah. Do you remember about how many participated last year?
We had hundreds of participants.
Yeah.
I don't remember off the top of my head how many.
Okay.
I mean, normally we have that big group shot of everybody together. You know, I'm looking forward to next year that being a possibility again. There's going to be lots of celebrations. It's going to be a year of celebrations next year after this pandemic.
So, and just to be clear, the proceeds are for your New Directions Counseling Center, right?
100. So all the proceeds come right back to our counseling center, and they help to provide the treatment for the clients who reach out to us. So oftentimes we have a sliding fee scale based on income. So someone will come to us and we look at their income and say, okay, based on your income, you'll pay, $5 a session or something like that. So that they're invested in it and they're paying something, but the treatment costs more than $5 per session. So this fundraising helps to pay for that. And also something that we've been trying the last couple months that we haven't officially launched yet, haven't officially adopted it, but we wanted to make sure that people reaching out for help got help as soon as possible. And so we have been giving 4 free counseling sessions to each person who reaches out, so that when they call us up, we can be focused on their recovery and not on how they're going to pay for the treatment.
Wow.
Because that is not what it's about. It's about somebody reaching out and us getting them in touch with a therapist as soon as possible. After those four sessions, we'll talk to them about a sliding fee scale and things like that, but we want them to get the help as soon as possible. So we've been trying that out the last couple months, and we hope that we'll be able to launch that as a long-term, as part of our programs coming up. So watch for the press release about that.
Okay, that's great.
Hopefully the board votes yes.
Excellent. So are you able to do in-person sessions yet or not?
Not yet. It's
Okay.
through telephone, Zoom. We're doing telemedicine, and but as more people are vaccinated, we look forward to that becoming an option again.
Right. Have you had to bring on more counselors, Rick, to handle the increased demand?
We are looking at that right now.
Okay.
That's something where we have brought in, that's another one of the silver linings of this. We had a therapist that moved outside our service area, moved far away and wasn't able to commute to the office. And then the pandemic began, and it was all telemedicine. That meant he could start seeing his clients again. So that was wonderful that he was able to do that.
Yeah. Have you seen a problem with some of the clients not having access to technology to be able to do that?
No, as far as telephone goes, if people are what we see is people aren't quite as comfortable with an hour-long session.
Yeah.
So if they're calling up and being on the phone for an hour, so they tend to be, half-hour sessions. A lot of people have opted for that when it's over the phone.
Okay. Going forwards, I know you're already starting to think about events later in the year. Anything you think can be in person?
So we are looking forward to hopefully doing a hybrid gala in December, where we will have a limited number of people at Granite Links, and then we'll let more people tune in from home. We're still figuring out what that looks like. This year we had to figure out what a virtual gala looked like and how to do a virtual gala. And now we're trying to figure out how to do a hybrid gala and how many people are going to be there and how can all that work. And so we're figuring it out, but we're looking forward to it and we're planning for it. We'll make a final decision in June. Exactly, we'll say, yes, we're going to do it or we're not going to do it. And we're going to really base it on last year we polled, did a survey of past participants, and most people said that they would not go to an event. And so this year we'll see what people feel.
Hopefully by then, the vaccination rate will be very high and there'll be a higher comfort level, right?
That's the idea.
Did Interfaith receive any assistance from the very latest American Rescue Plan, Rick?
No, we haven't received any federal funding. The city has given us some wonderful support. The Quincy Foundation, the mayor's office, really amazing support, and but no federal assistance.
I know.
We're just excited. Our volunteers who have been here on the front line since day one, they finally qualify to get the vaccine. So we're excited that all of our hardworking, amazing volunteers will now be able to get the vaccine.
Yeah, that's great. It really is. Anything else we should let folks know about right now?
Just going to the website, registering for 5K, whether you run or walk, that's not what it's about. It's about helping to contribute to support the program and raising awareness. That's really bottom line. Even if you don't participate in the 5K, go on social media, post about stopping the stigma of mental illness, talk about it with family and friends. That is the purpose of this, because there are people out there who are suffering and they shouldn't feel any shame in reaching out for help. So that's bottom line. We talk about the food pantry all the time, but here at Interfaith, our mental health counseling center is one of our largest programs, one of our most important programs, and one of our oldest programs.
Yeah, and I think it's important too for young people to hear that, because we don't know really how this is going to impact children going forward. So if it's normalized, for them to talk about it openly, I think that'll be a good first step.
That's the idea. Nobody, when somebody breaks their leg, they don't hesitate to go to the emergency room. And it should be the same way with emotional challenges and psychological challenges and anxiety and depression. Those are illnesses that need treatment, just like any other illness needs treatment. And people shouldn't be scared or feel it's not a character flaw to reach out for help.
All right, good place to leave it. And again, interfaithsocialservices.org, right, is the main website. And phone number, Rick?
It is 617-773-6203, and we're all over social media too.
Excellent. Hopefully next time you and I can do this in person.
Hey, that would be awesome. Looking forward to it, Joe.
All right. Thanks very much, Rick. Be well. Thank you to Rick Doan for joining us today. Thanks to our crew, and thank you for watching. Monday on the program, we'll catch up with Quincy Lions Club President David Sawyer. Don't forget to go to our website anytime, qatv.org. When you're there, you'll find our latest programs. There's news and information, video on demand, live streaming, and much more. For all of us here at Quincy Access Television, I'm Joe Catalano. Please stay safe.